Hello, my name is Dr. Natasha Patterson, Assistant Professor of Public Health at the College of New Jersey. I'm currently teaching the U.S. Healthcare and Health Policy class for undergraduate students, and we are continuing our studies throughout this semester. We went from in-person to online. One of the great things that came out of this, or one of the successes, is our in-class debates. Usually in class, students break in groups to discuss controversial topics and debate those topics from various perspectives, including the government perspective, the healthcare administration perspective, individual citizens, and interest groups. With that, we were able to continue this process online using Zoom's breakout sessions. And during the breakout sessions, students are able to continue to meet in their groups that they have been previously assigned. And they're able to discuss those topics amongst themselves. I'm able to pop in and out of the groups online and answer any questions that they might have, expand on some of their topics, help them give examples and things like that. We're able to come together as a class right after that and continue our debate. Students debate the topic, and then they are able to go back into their groups to discuss what they would come up with for their rebuttal against the other side. So students are voting for or against, or arguing for or against specific controversial topics. We talk about topics including vaccination laws and policies. We also talk about topics including laws and policies around environmental health, specifically water quality. We talk about topics around Flint water crisis in that respect as well. So students are able to continue to have these deep conversations and argue their perspectives, and they write at the end a reflective assignment that helps them articulate how they came up with their argument, what were some of their sources, and what the other side, what the points were for the other side. And then they also discuss and reflect on their own personal opinions and thoughts about the topic and whether or not it agreed with what they had to argue with or against in the class. That is actually one of the fun things about doing these debates, is that you have to argue from a perspective sometimes that's not your own, and it allows you to put yourself in the shoes of other groups and be able to see through those lenses. And in this class, we also discuss articles in the news related to topics that we are talking about, or the content area for that week. So this week we are talking about Medicare and Medicaid and CHIP programs. So those are your government health insurance programs that cover various populations, and students are able to actually look at what is happening in the world today and bring back some key news items that cover that specific topic, and they lead the discussion in the class about whatever questions they come up with, to have the class be able to discuss those topics. So we're able to continue those. We're able to continue our integrative learning, our interactive learning, communication. Each week I post an agenda for students so that they know each week what we are going to be doing. They know the expectation for the week and the timeline for getting some of their work done. And the students have expressed that they are very appreciative of that because it helps them with their organization and time management. And I'm also doing one-on-one sessions with students just to kind of answer any questions they might have about assignments, class content, or even just to vent about some of the challenges going on as we move from in-class to online. And we are pushing through the semester, and we have a few weeks left, and hopefully, and what I've been encouraging my students to do, is that we can finish this semester strong and move forward with our goals for once the spring semester has completed. Thank you.